DR.VIKAS. So I did my BTech and PhD here at IT. So during my studies at IIT, I invented one algorithm technology which can generate a 3-dimensional model of a bone from its 2-dimensional X-ray image. That is called as X-ray to 3D now. So with that technology, now we are making a product. We have started a startup at IT Bombay, Sign Incubation, and we are making a product for 3-dimensional surgery planning and instrumentation design for knee replacement using this X-ray technology.
Yeah, so initially the invention was very much appreciated. We got a lot of awards, even from President of the India. We got to Silicon Valley, and there through that route we have learned that what would be the challenges and what would we need to do to bring this product to the market. What product will be developing from this technology called as X-ray. Now the first challenge we found was team. So this is all. So first of all, it's a very novel in the world. There is no 3-dimensional surgery planning based on X-ray image on cloud platform in the world. So it's a new domain, and we need people who have knowledge in biomedical, mechanical engineering, and computer graphics. So finding those kind of people is very difficult. Even now, I think I have only three more people who are helping me. So there is a challenge in product development. There is a bigger challenge in product testing. So we are lucky that we are in India. In India, doctors are very supportive. If they find something innovative and help society, they will try whatever they can. And it's different than Western market. In Western countries, doctors have not have much freedom to test a product on patients using the medical images, and that is possible in India. So innovation wise, India is very good, but testing wise, if you want to have a clinical standards of FDA and all, then it is quite difficult. You have to go through US channels of medicine and hospitals and facilities. So we are still figuring out who to partner with for testing and all. So what we have learned is that if it's a completely new product which is based on some medical need, which itself has a product, which itself has a life cycle. For example, knee replacement. Right now, knee replacement is there are too many knee replacements happening, but maybe after 10-15 years it will be obsolete because some new technologies are coming up. So all the technologies made for the knee replacement, like our technology, that has to be built and tested very fast. And if you want to do it fast, then you have to collaborate with some of the big giants companies, and there are very few, 5 or 6, who are working on this area. So that's what we are figuring out now, who to partner with and all. What else? Funding. So probably in India, it's we have a kind of good ecosystem for medical device innovation funding. At least, so our projects are all funded by government through BIRAC, and for initial product development, it's all working well. But maybe for further marketing and stuff, I think for that we will do partnership with some giant companies. So that's it. Okay, so Startup India has two things. It's just a policy in itself. Same Startup India and Digital India both. Just policy in itself and as an initiative itself. So the initiative helps a lot, because when the government talks about Startup India and Digital India, and so much money is poured into it and a lot of collaboration poured into it, then as a startup you will also find a lot of investors or collaborations. For example, when I talk about my product, which is more of 3-dimensional virtual surgery planning, so it's like more of digitizing of the whole system in the surgery planning. So when it matches with the Digital India, then investors get very attracted that okay, this is the good futuristic product which is required in the India and will be supported more. So as an initiative, these things help a lot. As a policy, some may help, some may not. For example, IP policy, I think that may help. I have not used it, but okay, there are these in healthcare, a lot of patents and IPs come up when you invent something, so it may help there. Funding, so we have got all the funding from government. well, those programs were already there, but now more enhanced. Like BIREC program, there is one thing came up, BIREC IAPMA scheme for digital healthcare startups. So that came just, I think, last year. So maybe that's because of this initiative. I don't know. So we got one from that. So that's how it helps. About those tax things, in healthcare, what happens is product life cycle is very long. Even the development cycle is very long. So till then, there is no revenue anyway. So no revenue, no tax. So that may not. I don't know. For me, it doesn't matter. Maybe in future. But the other things, and as an initiative, these two things definitely help. Yeah. So innovation in healthcare. So first of all, yeah, we have been. There is a lag. We are behind than Western countries. If we talk about innovation in healthcare, they have started first, and we are kind of following. If you know Stanford Biodesign program, that is what followed by every, not just Indian but Asian places. What we need to actually understand is India itself is a big healthcare market, India and Asia. And if you want to really innovate something great, rather than following some technology or product which is already working on the West, I think we have to take care of, or we have to look for what are those gaps in the Indian healthcare market. So for that, there is a need of collaboration between product developers or engineers, collaboration between the doctors and the, say, entrepreneurs or business people. So all these people and even the policymakers in the country, when these all people come together, then you can make or innovate products or any invention for the Indian market, Indian patients or Indian people only. And some people are trying to do that as well. In IIT itself, there's this Professor Ravi who has started this lab called as BETIC lab, Biomedical Engineering Technology Incubation Center. It try to address the problems for the Indian people. So they meet doctors of the country and try to understand what problems do you have and make innovation specifically for that. Now this is just a start. How good it will be and all, it all depends on not just innovation but further entrepreneurship and market plan and business plan and all. But at least as a start for innovation, that is good. Second thing is not just for the country but even for the world, there are huge gap because medicine has not been using all the technologies available. For example, if you look at automobile, robotic surgery or robotic manufacturing or computer-aided design, all has been already used, and the whole automobile industry can be automated kind of. But in surgery, there is still not being done. So there's a huge scope of technology being implemented in the healthcare or surgery in specific, because I belong to that part. So we need to just we just need to cross those lines. We need to think something new rather than just getting inspired by the technologies or products which are already there. So something novel should come up. So yeah, there's a huge scope. So initially we just had the technology which converts image into 3D model, and using that technology you can build product based for India as well and global as well. I mean Western market as well. But there's a difference. It's not the same product can be used in the same way, because in Western market the more priority is quality, accuracy, performance of the surgery. The cost is not a big factor there. But if you look at India, the cost matters first. So if your product is, for example, our product that does both. It gives better accuracy or better performance as well, and it reduces the cost also. So the product suits in both ways. But since it's a disruptive product, I mean it changes something previously used. That's why Western market accepts it more. In Indian market, what happens is if you have FDA mark from USA, or if you have a product tested in USA, then it is accepted very easily in India. A new product may not be, and there are examples around. There's a lot of implants people have made. They are only sold because in interiors, because it is lower cost, but you can't sell them in Hinduja or bigger hospitals. But if you bring the same product of good quality through US market, then it is accepted in India. So when I say global, it is for the India maybe, because India has a bigger healthcare market also, maybe bigger percentage of the complete global market. So it is for India because it is low cost, but even then I can't directly the better strategy to launch it is through global. And when I did a market survey in India and USA, I also found that USA has more acceptability towards the product just because it has better performance and they don't care about the cost. So that's a difference when you create a new product. There's a difference, different needs for Indian market and different needs for Western market. So what happens is, healthcare product development is very costly. Not only because, so it is more about, ours was a software. If it's a hardware, then healthcare requirements for hardware are in material wise, technology wise, testing wise, it's very costly. You need an incubation lab setup, even if you want to do a startup. So like lab setups in IIT or something like that, you need to collaborate. On yourself, you may not be able to develop the product properly. Even when we have a software, and software can be made on the laptop itself, but for testing you need a lot of funds for you need to collaborate with some hospitals to get the patient's data and do some clinical trials. So for that you need a lot of funds. But so for that, governments have good policies here, or good funds here. It's competitive, but they are there. Like BIRAC I mentioned. I think BIRAC is the only one, which is by DBT, which have multiple schemes to do for different projects, type of project. So that is very important, and in India it is there. But you will not get many private investors are not interested in giving that seed fund for creating a product if you have just a concept. Unless you have a prototype, they don't invest. So there, this government plays a very important role. They should give a seed fund to make a prototype. Then this prototype can be shown to the investors, and you can make it big. So yeah, so for initial prototype, it's a very important thing to get initial funding. So as I said that the Indian healthcare innovation has grown itself these days, last 5-10 years. Before that, we were trying to learn. For example, one of the lab in IIT where I was working, they were trying to build a knee implant, which is just exactly not much different than what is available in the Western world. It is a success story for India that we made our own implant. But if you sell it in Western market, they will not take it. But we have learned how to make it. It took 10 years, but it's good. Now with that ahead, the same lab is now developing, the lab which I mentioned, the same lab is now developing new devices. So now they have learned their part. And these new innovations can be disruptive also. And whenever there is a disruptive innovation comes, Western market or any market, any people look at it as a great risk. So I have been also had a chance to pitch at Silicon Valley with this innovation, and I got a good response. Saying that, but not every startup is doing the same. But yeah, there's a huge scope of disruption and getting a new, exact novel technology. So the more novel technology you make, the great respect you will get and get good response from technology point of view. From business, I'm not sure.
Hi, I'm Poojary. I am part of the IITB incubator here at IIT Bombay, where we are working towards next generation diagnostic tools. I got a grant from the Bioignition grant from Department of Biotechnology. This grant helped us build the device from the initial prototype stage to the current alpha prototype stage, which we are currently right now working on. The grant helped me a lot in terms of hiring people, getting consumables, getting the initial equipment that I'll need for building the device. And as part of this grant, we are incubated here at the Sign Incubator, and now we are trying to raise funds for the next level. We are transitioning into a company using which we commercialize the device. What I feel is the number of entrepreneurs in the healthcare segment is increasing to a great extent now. If you look at the number of startups now are supporting a lot of healthcare startups, specifically in the app area. But I feel in the long run, I think in the next 2-3 years, you'll see a lot of hardware startups coming in this space as well. With government initiatives coming into play, like the bioignition grant from BIRAC, a lot of these hardware startups are taking the risk to give a competition to the foreign companies which are coming down and setting up the infrastructure here. And I feel in the next few years, we're going to see a lot of hardware startups in the medical space. What I personally feel is the Startup India program, though it's initiated, we've not got the real benefits as of now. But I feel it's motivated a lot of people to get into the startup wagon, and a lot of people are now encouraged to take up startup as an alternative career option. What I feel is as part of the incentives that are given, capital exemption is something that I don't think a lot of people will be able to take benefit of in the 3 years timeline which the initial startup has to go through, because they don't end up making a lot of profits then. What I feel is maybe if we can get something like for a hardware startup like us, we would require something like maybe a export something like a duty-free exemption, where a lot of components that we import from abroad, if we can get import duty exemptions, that would help us a lot. So as part of the Startup India campaign, which has been motivating a lot of students and people who are normally would prefer taking up a job, they've started looking at building a startup as a possible career alternative. And what I feel as part of the initiatives that the Prime Minister's launched, the income tax exemption which he suggested for startups, in the initial 3 years, I don't think a lot of startups end up making a lot of income. And for a hardware startup like us, where we import a lot of components from abroad, if you can get something like an import duty exemption, where we end up paying a lot of money to the customs, if we can get some exemption there, I think that's going to be a very helpful. Talking about the funds of funds, the 10,000 crore startup fund which government has introduced, I feel it's going to help a lot of startups, but the problem is how it's going to be distributed. We have no clear idea on. If we can get clear perspective on whether the banks are going to get involved in it or VCs, how exactly it's going to be distributed, I think that will help us a lot in getting perspective on the distribution part of it. And obviously it's going to help us a lot for startups which are where investment for hardware manufacturing is involved. I think capital plays a very major role, and I feel the startup funds would help us a lot. So I feel innovation is many times driven by universities. I think that's where the main innovation comes from. But if you look at getting ground entrepreneurs interested in innovating products, I think it's also the risk-bearing capacity of the venture capitalists and investors. The Indian investors should be willing to invest in ideas which have not been thought of and which have future potential of growth, but then they're still experimenting with it. I think that spirit of taking stride in places where there's no one has ventured for, I think that's where we should go forward if we want to motivate people to go and do innovation in this space. Challenge with the healthcare startup is proving whether the efficacy of your device is actually proven and tested. And for a startup, depends on what kind of issues they face when they're launching. I feel you need to validate your efficacy. Many times people don't validate the efficacy of the device, and when they launch their products, and they feel that over the long period we'll figure it out, but that doesn't work. I feel you need to do proper clinical validation before you even take the device to the market. And based on the validation studies, I think it'll help you in your marketing your device better as well. And what I feel is the startups need to comply to more stringent norms like CE or US FDA, which gives customer confidence, like at least in the Indian market where foreign products are dominating the market, to make a customer more confident about your product. I think you should focus on getting US or CE regulated certification for your product, based on which you can prove that your device actually can compete with foreign brands, and that will help you sell your product better in the Indian market. So in terms of data being used by startups for monetization, I feel in India we still don't have the culture of storing data in electronic medical record systems. It's slowly being adopted. I've seen a lot of government hospitals adopting EMR systems in their daily practice, and they've been successful as well in deploying it. It's improved their whole practice system and become more systematic in organizing the whole patient record system. But the challenges is adoption. Like I've seen a lot of companies which are using the data to give suggestions to clinicians, like more like a decision management system. But I'm not sure about the adoption for a system like this in the Indian market. Again, the efficacy of a system like this needs to be proven before it gets mainstream. And I feel that once the companies can prove the efficacy, only then can we move towards data-driven diagnosis or even prescription in the future. So if you look at the innovation ecosystem in India right now in terms of universities and private colleges, I feel they don't have that incentive or the motivation to take that risk and build products in that space. The challenge here is motivating these students to take that risk, and I feel the government is working towards this. There are awards like the National Gandhian Innovation Award, which is motivating students even in rural colleges to take up working towards diagnostic tools. And again, the government of India, specifically BIRAC, which is working towards awarding small grants to these college students, taking their product from their prototype stage to a commercial grade version. So I feel the ecosystem is slowly growing, but looking at the size and magnitude of India, I think it will take a bit of time by the time it matures to a stage where we'll have great startups coming out of India.
My name is Greeshma Unnikrishnan. I'm one of the co-founders of Medprime Technologies, which is a medical device startup. We're basically into designing and developing innovative devices that will make healthcare more accessible to the population. We started out around 3 years ago. We are 4 co-founders. Mahesh, Binal and Samrat are the other 3. This all started out while we were doing our MTech in biomedical engineering here in IIT Bombay, where we decided that we didn't want to go through a traditional placement route and we wanted to do something that makes a difference. So that is how we started with Medprime. Initially, one of the product that we started working on was an intravenous infusion monitor, which will eliminate the need for someone to continuously watch a patient's infusion and stay up throughout the night to call the nurse when it gets over, and all the stress that comes along with it. So what we initially started out was a simple monitor for that. Testing and trials is still ongoing. Right now we've moved on to we have added another product to our portfolio, which is basically a portable digital microscope that can be used on the field for screening of diseases which require microscopic analysis. For instance, you have malaria and sickle cell anemia, any kind of infections. So right now you have a lot of rapid diagnostic kits that are used in the field for screening of certain diseases, but you do not have anything for diseases that require microscopy, because microscopy is still the gold standard, and conventional microscopes are meant for benchtop use, and you cannot transport it from place to place. You often end up ruining it. So that is what we have developed. So we've developed a portable microscope. The additional feature in that is that it works with a digital display. That is, you have a mobile phone or a tablet display, which enables you to directly capture the microscopic images in very good resolution, and then you can transfer it remotely for by diagnosis by a patient by a pathologist sitting elsewhere, or you can even save it, add it to a database. You can do some processing on it, instantly, to have automated diagnosis for certain diseases. So that is something that we are working on now. We have that product that is going into commercialization right now. So one of the things that we realized while we were doing, once we had the initial prototype developed and we were going out into the market and talking to people, is that the medical sector is very resistant to change. Like, it has been a very conventional and traditional industry for a long time, and people are sort of comfortable in the way things are moving. So no matter how innovative your product is, or how important it is for a doctor or a nurse to have it, or for it to be there in the hospital, and no matter how much benefit it gives, there is always a certain obstacle about someone actually trying it and buying it and making it a part of their system. And what we have realized while talking to these people is that even if you have a completely new technology and you have a completely new product, you need to make it design it in such a way that it needs to seamlessly fit into their workflow as it is now. And the only way to make that product more acceptable is to make it as similar to what is there now, although it may have a completely different technology. If it is a drastically different user interface, or if it is completely changing their work routine, then the acceptability to it sort of increases. So that is one thing that we have realized. So one of the best things that has come out of the Startup India, Digital India, and all these initiatives is that startups have gained a lot more acceptance, and that is particularly important in a healthcare startup. I mean, if it was like 5 years back and a new company was trying to make a medical device, and if they went to a hospital trying to sell their device, I don't think they would even like listen to us, because they have suppliers for everything. They have their known companies, their branded things, and they would probably not even take this seriously. But now with so much recognition being given to startups, and it's everywhere. The importance of startups and the work that they're doing is portrayed in such a positive light that when we go to a customer and say that we are a startup, we are from IIT Bombay, we're doing this, they actually listen to what we have to say, and we are ready to at least trial the device in their facility. And this is across all sectors, even when it is in recruitment. Earlier, if it was like a small company with no media coverage and all, if we would try to recruit someone, that is very difficult. But now, because startups are so popular, to get a talented individual to work in a startup has become relatively easier. The whole concept of having equity and later incentives coming in later on has become quite popular to people, and people are aware of it, so that becomes a little more easier. The other thing would come out of it is, although it's still in the process, industry academia relationships that are coming on for a hardware R&D startup like us, having these access to these technology from institutes, from research organizations would actually be helpful once it comes into effect. Having that industry academia collaboration is going to be a big advantage for technology startups. So I have not particularly faced any difficulties because I am a woman in this sector. So personally, I have not come across such an experience, probably because it's in Mumbai, and in general, I have found that the culture in Mumbai is much more, it's equal for both men and women. That's what my personal experience has been. There have been a few instances when I've had to go outside the city into sort of rural areas or less developed areas, and there has been, a very subtle difference that you would notice that people, if you are in a conversation, they would probably look at if I am going with one of my partners, they will probably look at my partner and speak to my partner more than me. So that is one thing, but in Mumbai, I have not really faced that problem so far, and hopefully that will continue. Yeah, so one of the reasons why I would say that innovation is a little lacking is, as it is in healthcare, you have a lot of obstacles. It's a difficult sector in terms of getting your regulations, but it's even more difficult if you are a hardware in the healthcare area, because for hardware startup to take their product, even after completing the research, after you have a prototype, to actually take it out into the market with the desired regulations and certifications and everything, it becomes a hurdle. Even getting that one hardware, like if you have to make a few pieces, you need access to so many different facilities. You need funding to initially make the dies for molding, and so there are a lot of things that are needed by a hardware company, it's more capital intensive, it's more labor intensive, and probably that is why you have fewer and fewer of these hardware innovations as opposed to, you know, web portals and software solutions which are more common in the healthcare area, because that is relatively easier to beta and easier to iterate and much less capital intensive as well. One of the challenges, especially in a healthcare hardware startup, I would say, I mean, it has been and it still is funding. That is something that we are still looking for. One of the main reasons that we think it is because it is essential for the investors to understand where the market is going and to invest in the technology beforehand. For instance, with respect to our company, we know that telemedicine is up and coming. We have a lot of government initiatives and even private sector companies and hospitals looking into telemedicine, because that is the next big thing in healthcare. And our product is something that's going to support that telemedicine and, you know, help diagnosis of diseases using microscopy remotely. So it is essential that investors understand, you know, the market coming up and understand what is the value of the technology today. Although it may not have a widespread market today, but it is going to be a big thing tomorrow. So investors who can understand that, who understand the market and who realize the potential of the technology that is being developed today, is something that is the need of the hour.
My name is MR.ASLAM, and I'm basically a founder of IT company, which is Acuradyne Technologies, and I'm also into a healthcare industry. So I have invested into a hospital, diagnostic centers, and all those things. Yeah, and we are running a school, which is a disabled children's school, as a CSR project of Acuradyne Technologies. Okay. And that's where this idea of automating the complete therapy, which is given to the cerebral palsy and the autism children in our school, that idea came up with. Okay, so we thought, like, you know, we'll work with IIT Bombay, okay, to develop a tool or a device which can automate the process of physiotherapy and the occupational therapy for the cerebral palsy children. And that's where, along with the IDC, we found a company which is known as Transpact. So Transpact is a company which develops a device for the automating the therapy for the cerebral palsy children. What it does basically, it simulates the vestibular system, which acts like a GPS system of the body. So the device will basically simulate externally to that organ vestibular system of a cerebral palsy children. So that's basically a device which we are building up with the Transpact. Right now we are into a beta phase. So we started with after the idea generation, then the POC, proof of concept, then we went for the prototyping phase, then alpha, and now we are in the beta phase after collecting all the feedbacks from the clinician. So this is what at this stage we are. So that's a brief about myself and the company, Transpact. So when we started working with IDC, yeah, so what we found out that in a cerebral palsy children and the autism, right, the vestibular organ, which is basically that controls your balance and the posture, right? And when a therapist, whether it's a physio or the occupation, when they do the therapy for those children, what exactly they do, one is, of course, let's say physiotherapist. So physiotherapists, they do a muscle development, right, using this physio. And then they give some external stimulation. Let's say, for example, using the swing. Okay. So in the swing, actually what they do when the swing basically works, so they are giving an external stimulation to this vestibular organ. So when we did the research, and we were at a idea validation stage. Now, a lot of people, like, you know, when we started talking to the physiotherapists, the challenge, what we found that the most of the therapists, what they are doing is, okay, they know that these are the different steps, okay, to do the vestibular simulation externally. But theoretically, like, for example, what we wanted to find out, the data was that what is the kind of a percentage of the treatment they focus on the vestibular organ, right? Whether it's a 50% or 40% or 80%. The problem is when this child comes to the center, they just do the certain steps. They don't focus on a certain kind of that okay, if I do let's say 80% of the time on the vestibular, then the guy will be the kid will be kind of start moving, or he can basically maintain his balance. So the theoretical data actually from the practitioner, we were finding a lot of challenge to basically get the raw data, the critical data, which basically then we have to send, we to hire some 4 to 5 guys to go and visit the therapy and actually observe what they are doing. And from those therapy, then we were able to extract that, oh, okay, from these kind of therapies, these are the different steps they are doing for the vestibular system. Okay, so that's the first challenge we found when we went to the market for the idea validation. That once we automate this, how much impact will create? So that was the first challenge, right? That you take your idea, your solution, and see that what is the impact. Yeah. So that was the first challenge we found in that. Now the second part was as an entrepreneur, when we decided that okay, with IDC we will take this product to the market, we will commercialize this product. Now, frankly speaking, as a serial entrepreneur and working with the academic was again a challenge. Okay, that typically you make a plan, you are pretty aggressive. When you build a certain action plan, that this is what the milestone you want, from idea to POC to let's say alpha and beta. But when you start engaging with the academic, especially when the team from the academic world is involved, so you're not able to cope up with the plan. That's the second challenge we found out while working with the academic research, right? So that's why we founded the company in 2013 and still we are at the beta stage. So that was our second phase. Now in the third challenge, what we found out, if you are basically doing an innovation, something new, now a lot of research, right, and a lot of testing it requires. It's not that okay, you know that this is a problem and you just build it and it solves the problem. You have to go through a lot of iterations in terms of testing the product. You try one round of testing and then you say okay fine, out of the 10 problems you solve the 3, and now again you do. So a lot of investment goes into this kind of a research where it's an innovation. So a lot of amount of time and the money it basically requires for the research and the testing. That's a third basically, I can say the challenge which we figure out during this from idea to beta stage. That's 3 things I can right now relate. Startup India. Now, different schemes. First I can say the grant, right? Now definitely as a startup, you need funds, right? It's a capital investment. Then you need funds for your research, for your trial testing. So the fund and the grant is something which I think every startup is looking, right? Number 2, it also, this particular program or the plan, see earlier this plan is not there. Now going in convincing some investor was kind of a difficult task. Now with this plan, this program, even we can not only on the grant, but you can reach out to the investors. Now they also have the confidence in the startup with this kind of a lot of boom about the startup, right? So what I feel that with the brand of Startup India, now you can also raise the external funding. This is the second thing I'm thinking, and actually we are in the process. Of course we have applied for the grant, okay, twice. At the same time, we are also reaching out to the people. Now with this Startup India, they have the confidence in the startups. Second benefit. And the third one, a lot of tax exemption which as part of the startup scheme, Startup India scheme they're talking about, right? So once you go into production, right now we are still in beta, but I hope and believe that once we go for the production and start selling the market, that tax exemption will definitely help because I'm also running an IT company, so we are into SEZ. So the tax exemption helps a lot to the entrepreneurs when you basically run your company. So these are the 3 I can basically just share with you right now, right? How do you think about the innovation? What I feel, if we start looking at the pain areas, right? Let's say in the society there is a pain. Yeah. The pain problem could be a social pain, or it could be let's say a commercial pain. Okay? Now, if you look at the pain areas and then you start thinking about solving those pain areas, right? And that's where the innovation comes in, right? You don't try to just say, okay, fine, this is a problem, and I'll just copy some technology or I'll bring some from outside India and solve it. No, when you say, okay, fine, and like what we did, when we said, okay, fine, there is no automation exists for automating this particular therapy system. Still, though healthcare is so advanced, but for this cerebral palsy and the autism children, still they are using the manual therapy system. How can we automate that, right? And that's when we started thinking about what could be like, whether on an IT side or on the device side. And finally we figure out with IIT Bombay some solution, right? So first of all, for the innovation, we got to think about the focusing on the pain areas. That's number one, right? And number two, yes, I mean, as you said, like normally people, they just think about different ideas, concentrating on certain one problem, right? Or people, they start just copying. I mean, like one startup comes in B2C, everybody starts focusing on the B2C. Rather, if we just focus on the pain, right, and think about out of the box solution, yeah. So that will basically encourage the innovation. Point number two, in innovation, you require a lot of patience, right? Normally, it's not that you have the problem and you just come up with a solution. You have to go through a trial and error in the innovation, right? I mean, imagine the bulb, like, innovation is bulb, right? It's not done just in 3 months. It took a lot of time and the energy and the patience, right? To try. So I think that kind of a patience you need. Today, like, as an entrepreneur, people are like, they want to get the success very quickly, right? Just you do certain kind of a business and get success. In innovation, you have to have the patience, right? Yeah, so that you can come to a right solution. So to encourage the innovation, I think we got to basically somehow build this culture of like, that hey guys, look, you need to have patience, right? Number three, in the innovation space, when we talk about the innovation, and especially in the healthcare, a lot of regulatory compliance, right? That, for example, in the medical device. Now, clinical trials, right? First of all, there is not a very clear regulation that what kind of a device comes under the clinical trial. So as an entrepreneur in the healthcare, when you start focusing on the innovation, you do also think about that, because if you don't follow the regulatory compliance, you cannot basically promote your product, right? So regulatory compliance should be very clear, number one. And number two, it should be easy. I mean, right now our team, they are spending a hell lot of time to figure out, to liaison with the DGFT and other authorities, right, to get the clarity and the paperwork. So that's again to promote the innovation. I think the regulatory compliance should be made easy. This is what I think right now. If it is made easy, I know people say that look at FDA, it's so complicated, right? And then only you get the reward. But if you can little bit relax the regulatory compliance and make it easy, I think that will promote the innovation. This is what I think about startup. Whether it's a healthcare or let's say IT or any industry, it always has a challenge. See, typically in terms of the employability in India, people always look at joining the branded company, right? If you take the example of the IT sector, and if you start a new company, yes, you'll face a challenge, right? To first recruit the right people, because you are a small company, right? You don't have a brand. So that's basically like a problem across the vertical. I don't see it only in the healthcare. Yeah. But yes, in the healthcare, if you say IT, yes, there are a lot of talent, right? A lot of people are focusing on the IT sector. But in healthcare, yes, analyst, right? In the healthcare industry, simply hiring a program manager. For our company, we wanted to hire a program manager, though we had all these technicians, the mechanical engineer, the design engineer, the CAD, that we've found out from the IIT. But hiring a program manager specific to device development was a challenge. So we basically, the way we solved the problem, we hired a normal program manager, right, and we trained them, like, on the healthcare as well as on the design, because our device, it was the healthcare, design and the mechanical. So we trained them initially for a month to wrap up on all those the technologies. That's the way we are doing it. Now, in terms of what the Startup India initiative or the government can do, I don't see that they can run some program to encourage people to join the startups. It has to come within your DNA. I worked in USA for 8 years, starting with Microsoft, then I jumped into startup, right? Because there is a culture. You don't feel insecurity if you move from a stable company to a startup. But here, the moment you join a startup company, the typical thought process is that it's insecure, like when you join this startup. So this is what the mindset is here, like that has to be changed. I don't know how. As you said rightly, it's easier to convince, and in healthcare it's difficult. Couple of reasons. Number one, I can say, see, for the investor, it is all about the valuation and the rate of return they are looking for. In IT, we know that the valuation, it grows fast, right? So you can easily, let's say as an entrepreneur in the IT industry, I can show my growth, right? Because the industry is so mature, right? And it's in the news, people know about the IT industry. So I can show the valuation, the IRR that convinces the investors. And in healthcare sectors, right? I mean, the people know that selling in the healthcare, for example, today we have this vestibular, right? And we are building up all our financial valuation as well as the IRR, right? It's a product, yeah. And penetration of the product, it depends on a lot of your advertisement, your marketing, and all those, which requires again investment, right? So really building a valuation, right, and then showing up very attractive IRR in a product in healthcare is little harder than the IT. So that's where I think for the investors, entrepreneurs, it's easy to convince investors into IT than healthcare. That's number one. Number two, selling. Like IT products or IT solution is easy to sell because today India is known as number one in the IT segment, right? In healthcare, still we are not number one, right? So let's say if I build a product in healthcare, now I myself know that it will not be as easy to sell the product in India or outside India as let's say export compared to the IT products, right? So that's where people think that the exit could be easier in IT versus in healthcare, right? And number three, look at in healthcare, the vertical, the domain knowledge. In the domain knowledge, you need the medical professionals, right? Now, challenge with the medical professional that we have seen, let's say a doctor. A doctor is focused, on his practice. If you try to, take out his 4 hours of time to review your product, for him it's a loss, right? And for him it's and also, apart from a loss, he's not excited, right? A surgeon is more excited about doing multiple surgeries in a day than sitting with you and talking about some innovation and building some products. This is what the mindset of doctors are right now, which I have in the last 3 years observed, right? Whereas in IT, you find out a lot of vertical experts, domain experts, which help you to build the product faster. So these are 3 different things I can share, that why it is easy to basically raise the fund or convince the investor in IT versus in the medtech of my medtech, right? Yeah. So definitely I see that in your medtech segment, if let's say a company fails, yeah, and I'll take my example, let's say of our Transpact. So we are building right now one product, right? And this product is for the cerebral palsy and autism children. Today we know the statistics where there are 175 million children around the world who are suffering with cerebral palsy. In India alone there are 17 million children. And our customers are the hospitals and the especially schools. Okay, let's say for example, we try to go and penetrate in the market and somehow because these kids are not from the paying class, okay, and we fail, yeah, then what do we do, right? Now, the strategy which we have in mind, that definitely this vestibular organ damage, yes, today it is widely found in the cerebral palsy autism children. But the research shows, and in healthcare, that even the diabetic people, okay, they also started showing the vestibular disorder. So what you do basically, you take the same product because in the last 3 years, over the period of time, we have learned so many things about that particular disease, right? Now you take the product, if you see that okay, product is not able to get the proper traction in the market due to the commercial reason, then now you start basically focusing on building the product, addressing the same pain problem for this different segment of your customers. Now the diabetic people, I mean, as you said, the diabetes is a disease for the rich people, right? So now you start focusing on reshaping your product, yeah, addressing the problem of the vestibular disorder for the diabetic people. So I believe in that, okay, in medtech also, you can bounce back, definitely.